Hello, my name is Tommy, and this is the first video that I am making for YouTube about my cubital tunnel syndrome journey. Exciting stuff. So, I should preface by saying the pink room, this is my sister's room, also my office now because she is way older and doesn't live here anymore. Uh, I am also probably quite a bit younger than most of the people who would be searching out something like cubital tunnel syndrome, uh, subluxing ulnar nerve, whatever your issue is, anything that has to do with the ulnar nerve. Definitely younger than most of you, but uh, it happened, and it surprised every doctor I ever went to for it, but it happened. So, you know, 23, which is an unfortunate age to be dealing with cubital tunnel, and I have it bilaterally in both arms. It's technically they're both just as progressed as one another, but I'd say it's worse in the right arm. At least it feels worse in the right arm. Maybe it's because I use my right arm for more things. I'm not 100% sure, but definitely feels worse in the right arm to me. But so I guess I'll go over my journey with it first. So last October 12th is when I first noticed something wrong with my right elbow. It was like it just felt off. I didn't really know how to describe it. I didn't think it was a nerve issue. I thought maybe I tore my UCL or something like that. I did not. The doctor I went to, a doctor at Midwest Orthopedics at Rush, the same doctor who did a hand surgery for me several years earlier. He put a screw in this hand. He did a great job on that. Look at that. Look at that. But he told me I subluxed my ulnar nerve in my right arm and I should wear a brace for 6 weeks. And we'll see from there. And then 6 weeks later, I saw him again. My right elbow was doing great. I could use it again normally, completely normally. It felt completely normal. The nerve would move around, but didn't really bug me at all. Honestly, I could just kind of feel it move between the medial epicondyle and the actual elbow joint. I could just kind of feel it going between there. But that wasn't that bad, honestly, and it wasn't all the time. It was just like occasionally, so that wasn't bad at all. And then in mid-May, end of May, like May 20th-ish, I got basically every muscle on this side of my body from here to my fingertips got insanely tight, and kind of under here too. And I couldn't, this was like, my range of motion was essentially like this, 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 this. It was very, basically just taken away. And then the pain wasn't that bad. I did notice some pain in like up here and kind of down the arm, but it wasn't that bad. But I did physical therapy for that. And I'd say about halfway through that physical therapy, I started noticing some issues in the right elbow again. So I started using my left elbow or my left arm to do everyday tasks again, and started wearing the brace again at night, as I did the first time, which worked. And I didn't really notice any progression this time, so it just kind of stayed the exact same, which at that point it wasn't too bad. It was just kind of like a slight tingle and a slight pain in the elbow, but nothing in the fingers. Like when I first subluxed it, I would feel tingling down the entire arm, which was annoying, but it wasn't that bad. It wasn't that painful or anything. And then about 2 months ago, the left elbow subluxed, and I started getting that same tingling sensations that I got in the right arm last year in the left arm. They weren't quite as prominent which I guess makes sense because I don't use the left arm the same way, but they were annoying for sure, but it forced me to have to use my right arm again, which was unfortunate because that definitely caused the right arm's issues to progress and get worse. Anyways, 3 weeks ago, I went back to the doctor who diagnosed me with a subluxing ulnar nerve and did my hand surgery about 5 years ago now. And he told me to get an MRI and an EMG, or prescribed, whatever the word is, ordered an MRI and an EMG for both elbows. MRI showed mild neuropathy in both and mild neuritis, and then the EMG showed moderate compression in both of them, 70% sensory function, but no motor function loss, which is good. And you can tell I still have those muscles. My hands still look pretty good. They look basically the exact same. I mean, this one's tight, but I think that might be for some other reasons. This one's not too tight. But yeah, so where I stand today, I had the appointment with my doctor, the second appointment, the follow-up, on Tuesday, October 3rd, and he told me that he was surprised because I'm young. He said this doesn't happen to people who are this as young as you, especially not bilaterally. So he was surprised, but he said that he will do the surgeries on me. I'm going to do the right arm first, and he said he's going to do an in situ decompression on both of them, and then he's going to probably transpose them. He said he's probably going to have to transpose them as well, which I don't care at all. I welcome that. I couldn't care less if it means a longer recovery time, as long as it means that I won't have to deal with these stupid nerves moving around all the time again. That sounds great. But he did say that I do not qualify for subcutaneous because I am too skinny. So he's going to have to do a slightly different procedure. I don't know if it's the same thing as an intramuscular one. I think it might be a little bit different, but the way he described it to me is he's going to have to use a little bit of muscle and create a sling, and then use what fat I have in the area to kind of tie it down as well, and suture the muscle and the fat over the nerve to hold it down. And I guess he's going to do that in both of them, assuming he does a transposition. But yeah, I am very excited for that. I'm excited for the pain to actually go away. It's been pretty unbearable. It's especially when it was just one arm, it was annoying. When two arms is unbearable. The pain, it can take me over sometimes, I won't lie, but I'm trying to stay positive. Now there's a light at the end of the tunnel as well, so that brings a little bit of hope to me. I know it's not a guarantee that the surgery will work, but 85% chance, I mean, I got B's a lot in high school and college. That they never failed me then. I'm hoping it doesn't fail me now. That's my outlook on the whole thing. Really, yeah. Anyways, so this is my first video. I'm kind of rambling along. I intend on posting these once or twice a week. This is my first pre-op video. I think I'll post probably two or three more of these before my surgery. Maybe post one the day before the surgery or day of, depending when the surgery is. And then I'll post a bunch of post-op videos as well. These aren't just for people my age, they're for anyone, I guess. It might be a bit different because I am younger. Doctor said I probably should heal better than most would, and maybe a little quicker because I am younger, healthier, and I look forward to the surgery. I look forward to maybe reading comments, and I can answer questions, or if anyone wants to give advice to me who's gone through this before, who is going through the same thing. It can be pretty unbearable, can be mentally taxing. I know I'm not in a good headspace at all right now, and I haven't been for a couple of months. So just want to say that there is hope. You can get through it, and yeah, I look forward to making another one of these videos, probably beginning of next week, mid next week. I don't feel that's not a phrase people say, but it's okay. It's okay. My brain isn't working too hot right now. Anyways, I should probably get back to work. I've wasted about 30 minutes making drafts of this video. This is the one I'm gonna upload though. This is the one. Yeah, all right, so sorry for the length of this video. I know I just wanted to make this because I really appreciate that people are putting their experiences up on YouTube and sharing their issues. It's really helped me cope, and it's really helped me get through this and what I should expect with the procedure and with cubital tunnel and subluxing ulnar nerve in general. So yeah, anyways, this is my first video. I plan on uploading a bunch more throughout my journey, probably throughout the next 4 months or so. You might see some regular uploading from me. I doubt these will get that many views, of course. Probably just a bunch of people suffering with cubital tunnel. Maybe a doctor or two will watch it, see what their patients are going through. I don't know. But please comment, ask questions, put advice, whatever you want to do. I welcome it, open arms. Yeah, I look forward to making these videos and going on this journey with however many people want to watch them as do. All right. Anyways, have a good one, guys, and I will see you next week.